The Research Design Service was established in 2008. There are 10 regions across England. We support all national peer-reviewed funding schemes. This is just an example of the funding bodies we support. And although NIHR is our priority, we also support the research councils and the Association of Medical Research Charities. The AMRC has over 150 members, and so we have a vast knowledge of different funding schemes. The East Midlands RDS has 2 bases. In Nottingham, we are based on seafloor in between East and South Block in the QMC. At Leicester, we are in the George Davis Centre. We have approximately 20 members of staff with a vast array of experience and expertise. As you can see, we have qualitative and quantitative methodologists, epidemiologists, health economists, PPI and information experts. The majority of staff are part-time, as we are also researchers, ensuring our expertise is up to date. There are several ways to get in touch, through our website, by email or over the phone. We normally ask you to complete our inquiry form found on the website. This will allow you the opportunity to give us more information on your fellowship plans and potential funder, so we can support you in the best way. This infographic helps you to think about all the elements within a fellowship application. The RDS can support you with addressing each of these areas. If we work round from the top, evidence. You need to show your planned research within your fellowship is a problem that needs to be addressed. Ensure you know the relevant literature and current studies in your field and demonstrate your knowledge within your application. Person. We can work with you to ensure you have appropriate supervisors or mentors, depending on what level of fellowship you are applying to. We can also work with you to develop your training plan to ensure that it is ambitious but relevant. Impact. It is really important to demonstrate impact within an NIHR fellowship, and we can help you articulate the impact this fellowship will have, not only on patients, the NHS or social care setting, but on you. Involvement. Even within a fellowship, you need to demonstrate meaningful public and patient involvement. And at the RDS, we have a patient and public involvement fund which can help develop your PPI. For fellowships, the amount of funding available is up to £150. Funder. We can work with you to ensure your proposed fellowship is within remit, as well as all the other processes that sit around submission. Design. We have a strong team of methodologists within the RDS who will be able to give you advice on areas such as appropriate design, methodology and recruitment strategies, but also how this fellowship develops you as a future research leader. We can also help signpost you to other services which might be useful or necessary for your fellowship application. At the RDS, we are happy to review your application, either in sections as you write them or as a whole application towards the end. We also offer mock interviews, which previous applicants have found extremely useful. Whether you are successful or not, we can help interpret feedback from the funding committees. This is an example timeline for planning your fellowship application. We would highly recommend starting early, as strong applications take time. Also, don't forget to factor in institutional deadlines, which can involve multiple approvals prior to submission. For all NIHR fellowships, you now need to submit a Schedule of Event Cost Attribution template, abbreviated to SOCAT. We highly recommend contacting the Clinical Research Network Study Support Service early, as they need to sign this off prior to submission. So remember, be prepared, read the guidance thoroughly and get advice from multiple sources. A fellowship is not just about the project, it's about developing you into a research leader in applied health field. Don't forget person, place, PPI and impact. Assemble the right team to support you, whether this is supervisors for doctoral level or mentors and collaborators for advanced fellowships. Give yourself plenty of time, and fellowships are extremely competitive, so don't give up, keep trying. The latest data from NIHR Academy shows the following success rates for East Midlands RDS. As you can see, you're more likely to be successful in your fellowship application if you have accessed RDS support. This graph gives an overview of the different funding scheme success rates for East Midlands RDS supported studies, compared to those which didn't access our service. We would like to point out that we do support pre-doctoral fellowships and have a wealth of knowledge in this area, so please get in touch if you're looking to apply to this scheme. For further information and support on all national peer-reviewed fellowship schemes, please get in touch through any of the following routes. Also follow us on Twitter for up-to-date information about fellowships.